Thank you very much and good afternoon. Today is our latest update on our province's COVID-19 pandemic response, and this is our first new briefing of the new year, and let's hope it'll be the last time that we start off a new year focused on COVID-19. As you know, the virus has changed and is spreading rapidly. The Omicron strain that has now taken over here in British Columbia means that we are in a different race, in a different storm now. The Omicron variant of concern has taken over the Delta variant and is now the cause of over 80% of the new cases that we're seeing across British Columbia. It varies slightly in the north where it's not quite that high yet, but the data that's posted on the BC CDC website makes it very clear that this has been a variant that has been dramatically different and is spreading in a different way. And those pieces of the puzzle that I talked about a number of weeks ago are starting to come together. It also means that we need to respond slightly differently to this new strain that we're seeing. While we are seeing the rates of hospitalizations and those in critical care slowly creeping up, it's no longer the case that we have 3 or 4 degrees of separation, that you know somebody who knows somebody maybe that might have contracted the virus. The rate of transmission that we're seeing now in British Columbia, like many other jurisdictions around the world, means that at this point, most people in BC likely have a friend or a family member or a colleague who has been infected with the Omicron variant. Right now, in the tug of war of transmission, Omicron has the advantage, and we see that in the rapidly increasing case numbers we're seeing here and that we're seeing around the world. For now, in British Columbia, we have taken measures to try and slow that down, and we are coping. But everything we do now makes a difference. Everything we've done up until now has also made a difference. Our efforts have mattered. So many people in BC are vaccinated, are getting our booster shots, and using those many layers of protection from keeping distances, wearing masks, staying home if we're feeling unwell. This is the right thing to do, and this is what will get us through this phase as well. It means a lot of people will get sick, and we are seeing that now. But your vaccine will protect most people from serious illnesses and from hospitalizations. And we need to make sure that we continue to do those other measures as well. We still have further challenges ahead, and they're going to be slightly different challenges now. We know that some of the things that we did all along that made a difference with the strains that we've been dealing with are no longer that useful right now. In particular, because we have that shorter incubation period, it's 3 days, and the transmission is happening much more rapidly, and we have a disease that is much more undifferentiated. It means that a lot of people have milder upper respiratory symptoms that could be very similar, at least early on, to a cold or to influenza. That means that things like case and contact tracing are no longer reactionary measures that are able to work to help us contain this. It means that all of us have to be proactive in how we prevent ourselves from getting sick, but also how we prevent transmission to others. And our challenge across the board in the next few weeks will be dealing with high numbers of people who are off ill. And that may mean off work or out of school. It means out of healthcare. It means healthcare workers and educators who aren't able to go to work because they're ill. And for most of us, thankfully, because of our vaccinations, that will be a mostly mild illness. But the interruption to our business continuity is something that we now need to think more carefully about. And today I want to speak to businesses in British Columbia. Given this rate of transmission, the short incubation period, and the high number of people who are getting ill, we need now all businesses to put contingency plans in place to keep businesses operating when staff are off ill. At this point, given the number of people getting sick every day, we need to reactivate those COVID-19 safety plans. Those were the layers of protection specific to your business that allowed you to operate safely. We need to anticipate that as many as a third of your workforce at any one time may become ill with COVID-19, and they may not be able to come to work. And we need to adapt businesses so we can operate at these reduced numbers. Whether you're a private company, a school, a frontline business, or a healthcare site, now's the time that we have to prepare. It's not about public health orders and us telling you what to do. This is about activating all of those layers of protection available for your business in your situation to keep you from having to shut down because you don't have enough people to operate. So what do we need to do? First, remember, it is not just one thing. It's not about a rapid test. It's not about a mask that keeps one safe. It's about doing everything we can, all of us taking these measures to protect employees, our customers, and our family and friends. Every layer of protection is not 100% effective. It's putting these pieces together that gives us the protection that we need to keep operating. So what we need to do to prepare? Anyone who can work from home, you should be able to do that. Give employees and customers the space they need to stay safe. Remind and reinforce the need to keep that distance from people. Have fewer people in the same location at once, whether you can stagger shifts, stagger start times and breaks, making sure that staff are not all eating lunch in a small, unventilated lunchroom together, using those barriers, plexiglass barriers, limiting the numbers of customers in a space at any one time. Using appropriate PPE protocols. Ensure you have well-fitting, comfortable three-layer masks and having the ability to do things like washing your hands regularly. And, of course, vaccine requirements. These are important. We know they're in place in many employment opportunities, but requiring employees to declare their vaccine status so you understand the risk in your employees. And while vaccine right now won't stop all of us from getting infected with Omicron, it does significantly reduce the likelihood that we're going to have severe illness and be off for longer. It means that we can come back after that shorter 5-day isolation period. And it means that long-term recovery is the risk of having long-term symptoms is reduced. This week, our schools are also doing a staggered start. And this is, again, we know that schools are safe. They're the best and safest place for our children, and they are essential. They're essential for their social and emotional development as well as intellectual development. And it is not because we have any concerns about that. It's because as we've watched what is happening with Omicron and how it is affecting so many people, I have tasked schools specifically to take stock and prepare plans to safely operate over the coming months with the potential for reduced staff and keeping children safely in school and reducing the risk of functional closures because of staff illness. It's essential that we keep our schools open for children, just as we've kept grocery stores and pharmacies and hospitals open. This is going to be and remains our highest priority. We need to do this, and to do this we need flexibility from everyone, from administrators and staff and teachers and parents, and of course, kids too. If your children are higher risk, it may mean things like pausing extracurricular activities to focus on school and the importance of school. Thankfully, we know that COVID-19 remains, and even with the Omicron variant, remains mild in most children. And we know that with the availability of vaccines, it reduces the risk dramatically more for children and for staff. Everybody in schools should be vaccinated, and vaccines are the best protection for all of us. So while schools are most definitely a reflection and extension of our communities, they have not, and we've seen this consistently, and there's no reason to think it will be different now. They are not a major source of transmission. And schools, the measures that we have in place and adding in, going back to some of the ones that we were using early on, means that they are an important place to keep open for all students starting next week. As I said, this remains our highest priority, and I know the highest priority of the tens of thousands of school staff, teachers, educators, and parents and principals and school district staff across the province, and we're committed to making sure that we're getting children back as soon as possible and doing our best for our children across the province. And part of course, one of the important things that we have in schools is that we wear masks when we're in the classrooms, when we're in the school settings, and I remind everybody that the best mask is the one that you wear properly and consistently. And a good fitting mask with 3 layers is equally protective if it's the one that you're wearing. And remember that the mask alone, of course, is not your only protection. You need to use all of these layers, including vaccination, including keeping your distance, including minimizing the time that you're in a crowded indoor space, particularly if the ventilation is poor. I know some people have called for the increased use of respirators or N95s routinely, and I'll just say in the majority of settings, the incremental benefit in a low-risk setting like a school or a retail store is minimal. What is most important is that you have a good-fitting mask that you wear, and you wear appropriately. The other important thing, of course, is as much as possible, if you are feeling unwell, to stay home and stay away from others until it resolves. Don't go to gatherings, no matter how small. And testing is, of course, important. We now, as you know, are at our limit of our PCR testing, and we need to make sure we have that available for people where that test is important because they have underlying risk factors or may be eligible for treatments. So those are things that are really important right now, and we are using the rapid antigen tests that we have to be able to supplement that for people who have symptoms and are lower risk. I also want to say that I'm looking at other areas in our community to make sure that we're taking the best, most balanced approach we can. And physical activity, as I know, is incredibly important for our mental and physical well-being. And I want to thank those who operate gyms and fitness and dance studios for quickly supporting your communities by moving online during this period of high transmission in our communities. I know that this is incredibly important. At this point, team sports for youth and adults, we are trying to continue. However, I want to make it clear that no one, no matter your age, should be traveling for tournaments. And I know there are some leagues that are trying to get around this by scheduling multiple games. This is not about trying to get around or skirt the rules. It's about taking measures that we need to be able to keep providing some of these activities and reducing the risk that we're going to be bringing this home with us, bringing Omicron home, spreading it around in our communities. So all sports teams should be following the Via Sport guidelines, staying in your local sports areas, and I recognize this isn't exact, but we will work with each of the sports and make sure that you know what the rules are. And I encourage you all to default to less, not more, during this risk period. Finally, on Friday, we made some, given the challenges in staffing that I heard about from our long-term care sector, particularly as we were going into this long weekend past, we instituted restrictions to essential visitors only over this past weekend. And the intent was always that once we got the rapid testing available and had more plans in place to support staffing, that we would transition to one designated social visitor per resident in addition to essential visitors. I know, and we know, that our seniors and elders in long-term care have been hardest hit by this pandemic. And we also know how essential having those social supports of visitors is. And we are committed to making sure we can get back to having your one designated social visitor as well as essential visitors as the rapid antigen testing is being rolled out across long-term care homes and as staffing allows in this coming week. This will be in place this week as these are being distributed to long-term care homes, and every care home develops their plan to support this. A year ago, we faced challenges, yet we had the hope and promise of vaccines for all of us. And a year later, that is absolutely so important for how we are going to get through this next phase as well. We all may be weary, but we can take encouragement from what will be brighter days ahead. It is going to be a challenging few weeks, but we have the tools and we have that strong vaccine background that will get us through. We have faced adversity and we have met head-on with unwavering resilience and kindness and adaptability and compassion. Please continue to use all of those layers you have available to you and remind those around you to do that too as we weather our pandemic storm together.
Thank you, Dr. Henry. And I wanted to let you know that we'll be providing a COVID-19 bulletin this afternoon with daily numbers on case counts, vaccinations, and outbreaks. Today, I'll be providing an update on the accelerated booster campaign, but I wanted just to give you a sense of the challenges in our hospitals, the situation facing our hospitals in terms of total number of patients. You'll know that in our acute care system, we have 9,229 base beds. We've added 2,353 surge beds for a total of 11,582 beds. Today's patient census across acute care is 9,034, which is up over the last number of days, and obviously, though, lower than it was, for example, a month ago. In terms of critical care, we have 510 critical care beds and 218 surge critical care beds that are in place. We have today a patient census of 454 in critical care across BC. I think the challenge is the one that Dr. Henry has talked about in terms of businesses, but it also is a key challenge for us in healthcare. It's why we're taking the measures we've taken in long-term care, is not just to assure that beds are available, and we've done this through a number of means, including the cancellation of non-urgent scheduled surgeries starting in this period, in this January period, starting in this first non-stat or weekend day of January, but also other measures to make sure that we have a lower patient census than we'd already have, so we're able to have space for COVID-19 patients. But it's also the case that we're going to face considerable challenges with this much COVID-19 in the community in ensuring staffing's in place. So those questions are being monitored every single day, but that is the current status of hospitalization in our province. With respect to the accelerated booster campaign, I just want to remind everyone that 4,399,771 British Columbians have received their first dose immunization from COVID-19, 4,136,540 their second dose. And as of last night, 961,014 have received their third or booster dose. That's in the over 12 population. 92% of all those over 12 received their first dose, 89% their second dose, 21% their third dose. And since October the 27th, we've sent out 1,542,000 booster dose invitations. That's 40% of the eligible population for a booster. And by the end of this coming week, we'll have invited 46% of the eligible population. 950, as I said, some 960,000 boosters have been given in BC since the beginning of our booster campaign. And I want to just give you a sense of what groups have been focused on, because we have focused, guided by the advice and support of public health, we've focused on people who are the most vulnerable to severe outcomes. So 517,718 boosters or third doses for people 70 and above. That's more than 70% of the population, and significantly more than that of the eligible population, those who have received their first 2 doses. 630,866 for people 65 and over. That's almost 60%. And more than 50% of all those over 60 as of last night had already received their 3rd dose immunization. In addition, close to 100,000 healthcare workers, about 159,637 people who are clinically extremely vulnerable. Since New Year's Eve, December 31st, we've invited 378,634 people for boosters, and more invites are going out as we speak. And we will continue to invite those eligible over 18 over the rest of this week to clear all those by the end of this week. All those who have passed 6 months since their 2nd dose will have been invited to book by the end of this week. Following this, we'll be inviting individuals as they become eligible at 6 months or 182 days from their dose 2. Boosters are being booked in about 710 locations across the province. This is today, and more sites are coming online daily, in particular pharmacies and, of course, health authority clinics. And the number of pharmacies is increasing end of last week to this week by an additional 254 and another 200 in the middle of this month. All pharmacies are on the Get Vaccinated booking system. There are currently, as of today, 490,000 appointments open across the province. Capacity is growing on a daily basis. Newly added appointments are in pharmacies, both pharmacies and health authority clinics. Anyone who has booked can continue to revisit and try to move up their booking as capacity is coming on steam every day. If you wish to move your appointment, for children 5 to 11. As of last night, 134,822 people, children have been vaccinated in the 5 to 11 program with the Pfizer pediatric vaccine. 161,252 have booked an appointment, and 177,000, or now over 50%, 177,831 have registered. We very much encourage everybody, all parents to register their children today to get the pediatric vaccine specially designed for children 5 to 11 today. As you can see, roughly 39% of all children have received from 5 to 11 have received their first dose immunization. About 47-48% have booked an appointment, and about 51-52% now are registered. But that number of registrations has to go up as the gap now between the number of people getting the vaccine and the number of people registered is closing. And we obviously want more people to register. It'll make your children safer and, of course, your family safer as well. What will help us now, I think, is what has helped us all along, adapting our practices and actions, adhering to public health orders, and accepting the public health guidance offered, arranging to get our vaccines and boosters, and applying our COVID sense and skills to all our interactions and encounters. This is, of course, one of, and there have been many, challenging times in our pandemic, and that makes it our time to fight on. We have to continue to do what we all can do as individuals, as a health system, all of us together, to help people in these challenging times. To remember that great differences have always been made by our efforts, to acknowledge that our efforts have made the essential difference all along, and to affirm to ourselves that our continued efforts now will again make the difference we need. All of that is the case now, and I encourage everyone to continue to join together to do what we have in this challenging period of the Omicron variant of concern, do everything we can to help ourselves by getting vaccinated and following public health guidance, and everyone we know, those that we love, those that we know, and those that we do not know. Thank you very much. We're happy to take your questions.